Noah Pennington.
Afternoon. Sorry, I have a cold.
Yes.
Afternoon, I'm Noah Pennington. I'm from Driftwood, Texas. I'm represented by Senator Campbell. And I was born in South Korea. And my birth parents, they perceived me as worthless and inconvenience due to my disability. And so they put me in the foster care system, and I was there until I was adopted at 18 months. However, had they gotten an ultrasound before then and found out about my disability, believe it, they would have gotten me aborted under the severe physical abnormalities exception in the Korean abortion bill. And so, yeah, in Korea, physical disabilities are cultural stigmas that they don't want to live with. And these rights that many people are claiming that y'all will be trampling over by passing this bill are the exact same rights that abortion tramples over of babies. And so your role of government is not to control women's lives, but it is to protect the rights of all Texans. Thank you.
Thank you. Lainey Duro.
Yes. Good afternoon. My name is Lainey Duro. I am a resident of Texas, and my representative, my senator, is Kirk Watson. I'm here as a single mother and as a survivor of domestic abuse to represent a group of people that you're not seeing around here very much during these proceedings. I'm here to stand for these women because I'm fortunate. My children are older. I'm able to take time off from work to be here. I have the financial means to stay here all day to ensure that my voice is heard, and I don't think I currently have to fear my ex or my children's father if he finds out I'm here. Rather than spending, I just like to say that I'm appalled by the fact that we're spending $1.5 million on these special sessions and probably countless other dollars defending this unconstitutional bill, when if you really are pro-life like I am, you would spend that money supporting women who choose to have children. 70% of women who have abortions do so for financial reasons. That's disgusting. If you're pro-life, you support the women who are having to make this choice for financial reasons. That means you support Lilly Ledbetter, so that women-run households don't have to be statistically poorer than other households. You support the expansion of Medicaid so that families who already exist as full families do not have to go bankrupt when they have medical expenses that they can't afford to pay. You support education and comprehensive sex education so that young women do not have to have repeat pregnancies and possibly repeat abortions. Until we win those fights, we need to ensure that all women have the right to make the choices necessary to ensure the happiest, healthiest, most dignified lives possible for themselves and the children they already have. To me, that is the definition of pro-life. I am very definitely pro-life. So I just want to also add that the same things that exclude women and make it difficult for them to raise children will make it difficult for them to be here today. I just want to make sure that's clear to you all.
Thank you. Senator West.
The resource witnesses are still here.
I told them they could leave because I fully expected us to devote our time listening to public testimony.
Well,
we will have, when House Bill 2 comes over, we will have them back and have opportunity to ask questions of them.
the witness's name again, I'm sorry.
My name?
Yes.
Lainey Duro.
Brings up some interesting observations about the number of unwanted pregnancies that we have and educating young women about pregnancy. We've heard over and over again today and in first special session about the impact that abortions have on people in the lower economic strata. But yet and still, we do not have sufficient funding or educational programs in order to make certain that they that are the subject of many of these abortions have the best educational information or knowledge base possible to make certain that they don't have unwanted abortions. And we're not addressing that issue at all.
Well, I would suggest this is not the Finance Committee. This is the Health and Human Services Committee addressing Senate Bill 1. we could sure take up that discussion.
Well, here's the issue. The issue is that there will be a series of bills that will be introduced, one of which will be dealing with this particular issue of providing the necessary funds for sex education. And I understand it goes to finance, and that decision is going to be made by the Lieutenant Governor. And the question is whether or not it will be, quote unquote, considered a part of the call. And so if we're truly looking at this issue holistically, as opposed to through the eyes of Democrats and Republicans, but if we're looking at it as Texans, we sure ought to, and that's a Texas term, ought to consider that particular issue.
Thank you, Senator.
Thank you.
Tricia Heflin.
Thank you to my Senator, Dr. Donna Campbell, and to all of you for listening to us today. I am Tricia Heflin, and I'm from New Braunfels, Texas. I am testifying in favor of this bill. I'm a registered medical sonographer and started in medical ultrasound in 1979, close to the time that abortion became legal in our nation. At that time, sonograms were static, grainy images. No movement could be seen, no heartbeat could be heard. As abortion became big industry and we posed the question, when does life begin anyway? So technology advanced, and now 40 years later, with 3D and 4D sonography, Doppler capability, and in vitro cameras, medical science and technology has answered that question. We know that a baby in the womb's heart starts beating at day 19, that at 35 days, eyes start to develop, at 42 days, brain waves are detectable, at 56 days, all organs are functioning. And as this bill states, by at least 20 weeks gestation, a baby in the womb can feel and recoil from pain. Add just 1 week more, a baby can survive birth. Attached is a picture from the cover of a book, A Surrendered Life. The picture is of Juliana Layton, who was born at 21 weeks gestation, prognosed not to survive or to be severely handicapped. She is now a 24-year-old, beautiful, healthy, functioning woman. The scientific evidence that a baby can feel pain at 20 weeks gestation is mind-jolting enough to alter a woman's decision and allow her to realize she is making the choice of life or death on her baby, not just a clump of cells. Being post-abortive myself times 35 years, while the physical effects for me were minimal because mine was in early gestation, the emotional and psychological effects lasted for years. Through counseling and healing programs, I believe I am healed from the traumatic effects of abortion. But now I know I would change that decision in a heartbeat. Because I've experienced abortion and I see the evidence of life in the womb every day, I know abortion is never an act in favor of women. We must legislate on what we know now.
Okay.
Thank you.
Chaplain David Wheeler.
I am David Wheeler of Austin, Texas. I am also representing Angela Blackman and Marilyn Richmond of Round Rock, and Randy Lander, Christina Delgado, Jennifer Meade, Catherine Kimbriel, Kirby Kerr, and Susan Pratt of Austin, Texas, and my cousin Catherine Kaser Moody of Atkins, Texas. This bill states that fetal pain begins at 20 weeks. A study in the Journal of the American Medical Association published August 24, 2005, and states, and I quote, that fetal awareness of noxious stimuli requires functional thalamocortical connections. Thalamocortical fibers begin appearing between 23 and 30 weeks gestational age, while electroencephalography suggests that the capacity for functional pain perception in preterm neonates probably does not exist before 29 to 30 weeks, and concludes that fetal perception of pain is unlikely before the third trimester. The AMA had 215,854 members as of 2010. The Senate of the State of Texas has 3 positions as members: an ophthalmologist, a family physician, and an orthopedic surgeon. None of them are OBGYNs. Respectfully, I am forced to conclude that the considered opinion of the doctors of the AMA trumps the opinion offered by the supporters of this bill. This bill is flawed and should be voted down because the standards that are being included in this legislation do not reflect the considered opinion of the vast majority of medical professionals. It is bad science, and it would be a bad bill, or it is a bad bill. The heartfelt testimony that I have heard here on both sides reflects the pain involved in making the decision to abort a fetus. I have heard women express the emotional pain that they have in coming to this conclusion. In not a single case have I heard anyone suggest the decision to abort a fetus was made lightly or without serious reflection. Members of the committee, no woman gets an abortion lightly. The costs are too great. Bearing these costs should and must be each woman's choice. She does not require the assistance of the state of Texas to help her decide. She is a capable guardian of her own body. She has the right to make decisions for herself on any matter pertaining to her body.
Thank you, Mr. Wheeler.
Thank you.
Cheryl Weiblu?
Cheryl Weibel.
Okay.
Howdy. I'm Cheryl Weibel. I'm an Aggie. I'm from Caldwell, Texas. And I'm very proud to have Senator Hagar be my senator. I thank you for the bill that you proposed. I thank you very much. I believe in a civilized nation, civilized Texas. I am Texan. We can't use abortion as a means of birth control. I don't think it's right. I do believe life begins at conception. I do not understand, to pull babies out at 5 months, 6 months, 7 months, they do go past 6 months sometimes. And then kill it. I don't think that's right. I think it's a slap in God's face. Sorry, I'm nervous, but He's the creator of life. We cannot continue to do that. I think it's very wrong.
Thank you. Janice Ryan?
Yes. Thank you, Chair and committee members. My name is Janice Sue Sedin Ryan. I reside in Williamson County, Round Rock, Texas. I represent myself, and I oppose this bill. I'm a mother, I'm a wife, I'm a Christian, I'm a veteran of the United States Army, and I'm a registered nurse. I think we all agree that everyone deserves safe and quality health care. Everyone, including those seeking abortions. And as a surgical registered nurse, that is my #1 priority, safe and quality medical and surgical health care, regardless of the procedure. Abortion happens to be one of the safest and heavily regulated medical surgical procedures available today. In fact, an abortion is safer than childbirth. 14% more women die from childbirth and childbirth-related complications than abortion in the United States of America, per the Center of Disease Control. In 2011, 116 women died of pregnancy-related complications, while 1 woman died of abortion-related causes in Texas, per the Texas Department of State Health Services. I've heard over and over how this bill is supposed to be a safety net for women and provide safe procedures for women. This bill does not do anything to increase the safety or enhance or improve the medical or surgical abortion outcomes. This bill would have the opposite effect. The intent and purpose of this bill is to force the closure of 37 out of 42 health clinics in Texas that currently provide safe, legal abortions. This bill would severely restrict and or eliminate access to safe abortions and reproductive health care. This bill will hurt women and interfere with their private medical decisions. The medical community has voiced their opposition to this bill. The American Congress of Obstetricians and Gynecologists and the Texas Hospital Association. Thank you.
Thank you for being here, and thank you for your service as well.
Thank you.
Thank you to this panel. The next